Hello viewers, welcome to this week's edition of Health Corner. Today we're going to talk about hypertension, and we're privileged to have an advanced nurse practitioner who arranges training for practice nurses across the clinical commissioning group called CCG in Essex. This part of Essex, she works with all the other teams in the locality on a daily basis, and she has a very good experience about what we're talking about. Now, I'm going to introduce Sandy Thomas. Sandy, you're welcome
Hello.
to Health Corner. So, what is hypertension?
First, thank you for having me on this platform. It's a great privilege, at least to promote a bit of health across Essex and to all the viewers. Now, we're talking about hypertension. What I hear every time from patients, they say hypertension, high blood pressure. Like, what is high blood pressure? Several times patients says to me, oh, when I said to them, oh, you've got high blood pressure, your blood pressure is high. They're like, oh, nurse, what is high blood pressure? What is it? Because a lot of people, they've been taking medication for high blood pressure, but they don't know what high blood pressure is. So high blood pressure is, so when the heart is pumping the blood from, it pumps the blood from the heart. So the heart pumps the blood all around our body to our organs. Obviously our cells, everything, all the organs need bloods which carry oxygen and everything and nutrients to the rest of the body. So the pressure of the blood that leaves the heart to the rest of the body, that's the systolic. So if you're checking your blood pressure at home, a lot of people check their blood pressure. So the top figure, that's the pressure of the blood leaving the heart. And then the blood from the organ or from the rest of the body, leave the organs and go back to the heart. The deoxygenated bloods and everything go back to the heart. That the diastolic. So that's the lower figure. So that's the pressure of that blood who goes back to the heart.
So the heart is responsible for pumping blood across the whole entire body.
Yes.
And that pump requires some form of pressure. So, and this is what gives the pressure we're talking about.
Exactly. So ideally we want this pressure to be within some figures. Okay. So like normally we'll say to patient, we don't want to complicate things. You know, we are aiming a blood pressure of the top figure of 140 or lower. Okay, the lower it is, the better, not too low. So we're talking about 125, 135, even 140 is acceptable. It's a bit on the higher side, but it's acceptable. But that's the top figure, the systolic. Yeah, the lower figure, we're looking at 90, 80, 85, 75. So this is ideal. But so this is a bit of what is blood pressure. So we obviously across, my main role is to educate patient. I want them to know what is blood pressure and what is high blood pressure. So you know, the area where I'm working, you know, in Basildon, normally we have a lot of people with high blood pressure. Lots of the patients got high blood pressure, even younger people with high blood pressure. So the area where I'm working in Basildon, so what I have noticed, because I work in several practices, is the rate of high blood pressure, hypertension, is higher in the ethnic minority groups and patients that come from a deprived background. So that's you know, I've noticed that in a lot of health education has, you know, I have to teach people about eating, exercise, because obviously in ethnic minority group, what I've noticed personally, coming from an ethnic minority background myself, is obviously it's the way we eat.
So,
you know?
So what you're saying is there are some causes of blood pressure because the families at home maybe asking, so what are the things that cause blood pressure? Does it run in family? Is it the lifestyle, or is it ethnicity, where we come from? What would you say?
I mean, the primary causes of high blood pressure, you know, yes, it can be, you know, hereditary. It's in the genes. You know, it happened. But obviously, what I've noticed in ethnic minority groups is the way we eat. Myself coming from a mixed African and Indian background, so we eat a lot of salted food, like salted fish, Indian food, which is high in fat. Our food is very concentrated in fat, in salt. We use quite a lot of salt in our food, flavors. We add a lot of extra flavors in our food. So most of our dishes you know, has high salt content, and it's very hard to break that, to break that habit, because if you've been brought up on, you know, salty food, high fat content food, obviously where our family come from, our ancestors come from, you know, people there walk miles, they're using that energy, they're very active, but obviously now society is changing.
Yes.
There's development. People are working in IT, computers. So we're not as active. We don't do as much of, you know, laboring work. So not having enough exercise, then eating all this salty food. And also, I feel there's lots of health promotion and education in our community that we have to do. Because saying to an Indian woman, you know, to an African woman, oh, no, you have to, you know, a lot of my patients, I'm saying to them, no, you have to cut down your food, try to, oh, my husband's not going to like this, oh, the children's not going to like the food like that. It's about teaching them again how to cook, re-looking at their way of cooking, their lifestyle. It's all about health education, and this is what we practice nurses in Basel and Brentwood. This is our role, and this is what we've been doing, and understanding the culture and the background of all these different people, that patient that come from ethnic minorities, and teaching them again. And also, when they have high blood pressure, what I've noticed in the ethnic minority group, patients are not very compliant. They don't want to take their medication. Yes, they feel, oh, you know, they want a lot of, they need a lot of convincing to get them to take.
I know, fantastic. No, it's good you're touching that, because I know in the second segment, the viewers will want to hear what are the things they can do to either help them to control their blood pressure or to help prevent them coming down with one. I think some viewers, you know, you go to clinic and people come to you and then they'll say, doctor, this blood pressure, is it something that I have inherited from home, or is it something that is treatable? That will come in the second segment.
Yeah.
Now, you talked about weight. Do you think, so are you saying that people who are overweight or obese have the risk of developing blood pressure?
Of course, weight, not doing enough exercise, that's, you know, a lot of people are too busy, working, lifestyle, so not having time to exercise, obviously not making time to exercise, putting on weight, you know, does put a high risk of high blood pressure, heart problem.
So what about stress and lack of sleep?
Definitely, lack of sleep, stress. Stress is a big factor of high blood pressure. So now if you're already a person who is overweight, with bad eating habit, suppose you have a very stressful job and you don't have time to exercise, so you're really higher up there, you know, you're at a higher risk of having high blood pressure. But this is not the, you know, the end of the world. This can be changed around. You can turn it around, and you know, people are able to make changes to their lifestyle, which I can see happening. It's just through good education and health promotion and the support they have from their practice nurses, from their GPs, And there is like running groups in Essex, and people are meeting up. Now the weather is nice. I always say to my patient, try to take a brisk walk, you know. And you don't have to just, you know, a lot of people say, I don't have money to go to the gym. I don't have time. I just say, just go for a little walk. Yes. Just start little.
We'll talk about that in second segment, because I know you have a lot of knowledge and experience looking after people with blood pressure. So is it very common, people that come to the clinic, is blood pressure very common, or does it have any symptoms?
Yes, so it is very common because we are constantly checking people's blood pressure, and it's, you know, yourself as a GP, you might know, we are constantly having people to come in, we're checking their blood pressure as part of our everyday we do. And it is very common, and it's just, you know, one of these things, you know, I found it's more, once the patient has hit 30 plus, we start having problems. The symptoms people get, it's like, even the younger patient, headaches, dizziness, constant headaches, have, you know, a bit unbalance on their feet. Sometimes a lot of patients, they've had high blood pressure for a while, but they don't know about it.
They don't know about it.
They don't know about it.
Very good point, yes.
But part of the NHS health check that we do across Basildon and Brentwood CCG, that's when we get to find out who has hypertension. So
that brings the question, I know viewers might be asking, how often should one check his or her blood pressure? And is there a certain age you encourage people to check their blood pressure?
Yeah, normally we have this NHS health check in place, okay, which I would, you know, advise most viewers, if you're over 40 and over 40, ask your GP for an NHS health check, where we check the blood, we do a blood test, checking for cholesterol, full blood count. We do like a general blood test where we can pick if the patient has high cholesterol, different problems. And then the patient come back for an NHS health check. Then we get to check their blood pressure, their weight. Then we look at all the risk factors, you know, of the person developing a cardiovascular problem. So I'm talking about heart problem, the risk of the patient having a stroke in the next 10 years, and high blood pressure. So that starts with checking the blood pressure, and by checking the blood pressure and the cholesterol, so that tells us a lot of things about the patient and what we can do to prevent any other cardiac problem. So I would, you know, a lot of patients don't turn up or don't know about this NHS health check, but we do promote this across the CCG in Basildon and Brentwood.
So is there a certain age when they are encouraged to check their blood pressure? Is it every year, every 5 years, or every 6 months?
Normally, I would say once, if you're 40 and over, we do the NHS health check. If we find out you've got high cholesterol or high blood pressure, we normally, it depends on surgeries, but normally we say, come, we advise, we give lifestyle advice, and we say to the patient, come back after 6 months if the patient has really bad high cholesterol and the, you know, if the blood pressure is kind of borderline, but we give the patient a choice. We say to the patient, if, you know, we can start you on statin, or you can, you know, or normally we encourage patients to change their lifestyle, exercise, change of diet, and we see them after 6 months. We repeat a blood test, check the blood pressure again. We give that choice for patients. But most patients, they're not keen to go on medication straight away. Most patients are like, okay, give me a chance, I'll change my lifestyle, try to lose a bit of weight, and then they come back.
Now you've listened to the professional. She's talked to us about what blood pressure is and some of the things that cause blood pressure. And if you've listened carefully, you'll find out that our lifestyle, the way we live, some of the things we do, stress, not looking after our health is responsible for blood pressure. And we know that blood pressure runs in families. So don't go away. We're about to go into the second segment that will deal exactly with what you can do to help yourself either prevent you getting blood pressure or to help manage your blood pressure better. We'll be back soon. Welcome back, viewers, to the second segment of Health Corner. Today we're talking about hypertension. In the first segment, you listened to the advanced nurse practitioner, Sandy Thomas, who are taking us through the basic facts around hypertension, that is high blood pressure. This segment deals more with what you can do to help yourself. This is the interesting bit. But we'll let the professional tell us what she thinks we can do to manage this condition. So, Sandy, if you don't mind, what is it that we can do to help ourselves first before somebody gets hypertension? Is there anything he or she can do to delay that?
Exercise is the main thing. Exercise in the way we eat. Yeah. Like I say to my patient, you don't have to stop eating the food that you like. You don't have to stop eating your curries, your pounded yam, you know, your African food that you like, your Indian food. It's just the way how you cook it. Just be cautious about how much salt you're putting in the food and how much oil you're using. Try to use lean meat. Try to use very little oil or even fry light, healthy options. And secondly is exercise.
The exercise.
Incorporate, you know, when you're taking the children to school in the morning, if it's 5 minutes walk, let's walk. Let's save the environment too.
Taking a walk.
Yeah, let's just walk the children. But you see all the parents with all their big cars, all their cars driving.
Yes.
But maybe we leave a little, you know, take a walk. If that's a form of exercise for the whole family.
Exercise.
You know,
so families taking group exercises.
Exactly. Or then mum on the way back home can take a longer walk. That's the exercise.
Longer walks. Okay.
I mean, we at my practice, I work in the NES. Lunchtime, the GPs and the nurses, we go for a walk.
Yeah, right.
Because we have a busy life and we're sitting down, we're talking to patients. I mean, we are busy too, but being active. So it's something that one of the GPs started and we all been following this. And now the weather is nice, everyone tend to go for a little walk, half an hour walk. It makes you feel good and it's healthy. So it's our eating habit and it's exercise.
Yeah, still talking about exercise. Does other exercise like dancing, swimming help?
Of course. You know, exercise that, because not everyone's want to run or, you know, exercise has to be something that you enjoy.
Yeah.
If you enjoy dancing, why not? Just put the music on and just let yourself go and, you know, dance. A lot of people do that. If you enjoy swimming, I mean, we've got great facilities in Basildon, so people can go swimming at the leisure centres. They can go swimming. If you enjoy walking, if cycling.
Cycling,
I mean, yes, there's different ways of exercising. It doesn't have to be just running, just going to the gym, doing the weight. There's different things, different ways of exercising.
Right, so under exercises, so you've mentioned cycling, walking, swimming, what else, dancing, you know. What about things like yoga? And
yoga is a very good, it's a good form of exercise, especially for people, you know, with fibromyalgia, people who can't, you know, got arthritis, gout. They can do yoga, that's very good. Swimming is good.
Okay.
So gentle exercise.
No, that's good. So the older people who are not able to cycle, they might be able to do yoga and walking, isn't it?
Yes.
Because what you're saying is, we don't encourage people to just be at home, not to keep active. People should keep active.
Yeah, keep active. Also, do you know what? It's doing your housework is a form of exercise, you know.
Yes.
You know, it keeps you active,
Yes.
you know, and doing gardening. The elderly, a lot of my elderly patients, they enjoy their gardening, and that's a form of exercise for them.
Fantastic, yes.
Yeah.
So, I know some ethnic communities, the older one thinks, oh, they don't need to do anything, everything is being done for them. But actually,
I know, yes.
they should actually stand up and do those things because it helps them. Helps the blood circulation.
Exactly. I do, like, you know, promote this in my patient with my ethnic minority patient, because a lot of the time the elderly, they like to have their heavy lunch, then they go to sleep for the afternoon. So I get that with a lot of my patients. So I tend to say to them, why don't you just go for a little walk, get some fresh air, or even indoors, do anything that you like, keep yourself active. You know, then you can rest and just little things.
Yeah, it's across the board. I mean, it doesn't have to be ethnic minorities. Everyone across the board.
Yeah, everyone.
To keep active. And now people are coming out of the lockdown.
Exactly.
People have probably put on some weight. And
this is the excuse we've been hearing.
Isn't it?
Yes, a lot of patients that's come back, we're seeing them face to face. We've been talking to a lot of them on the phone. We've been doing the diabetic reviews. And people has put on weight. The blood sugar's gone up. The high blood pressure.
Blood pressure has gone up as well.
And the excuse we're getting, I mean, it's not an excuse because some people can't help it. They couldn't go anywhere. And, you know, it's also boredom. A lot of people's been eating. And I'm sure it concerns all of us, really. We haven't been as much active as we used to be. We haven't been going to the gym. We haven't been, you know, if we used to meet up with friends, go for walks or exercise, a lot of people haven't been doing that. So, yes, we are finding that when people are coming back now for their health checks, diabetic check, it's the same thing. Everyone's been putting on weight. And so,
and I think you mentioned stress as one of the causes of blood pressure. So does exercise help people to de-stress?
Definitely. I promote exercise a lot for my patient who's going through depression, because that helps your mood. It helps the brain to produce good, happy hormones, and it motivates you. Because a lot of the time you might feel, oh, I don't want to do this, I don't want that. If you go for a walk, brisk walk, you feel happy, you feel energized, you feel like, you know, it's like the brain does produce happy hormone if we exercise and keep ourselves active.
That's good.
So it keeps the mood, it uplifts the mood. So, you know, I do tend to encourage that a lot with my patients.
So what you're saying is, even though hypertension is part of physical health, but exercise helps not just the physical health, but it
also the mental health, definitely.
The mental health. And so people with depression can take exercises. I know you see all these people anyway every day, and maybe at some point we'll get specialists in mental health to talk to us about different aspects and what exercise can do. Now, so exercise is key, which is fine. So does exercise also help people who have high blood pressure as well as people who don't have high blood pressure?
Of course. Exercise is the best. It's the best cure, really, for high blood pressure. Even if you don't have high blood pressure, it prevents you from getting high blood pressure. It prevents stress. So we do, you know, encourage that across all the patients. I do promote this across all my patients.
I think our viewers will be happy to hear this. Yes, exercise is one thing. You're talking about diets. I know you. So, especially the Indian, African ethnic groups, certain food they eat is also responsible, isn't it, for their health, physical health? So, are you saying that the heavy food should be eaten at a certain time of the day so that they can burn it off? Or?
I mean, what I tend to say to my patient, you know, if you're going to have roti and curry, you want roti and curry, and you're a diabetic patient with high blood pressure, you know, obviously you can't say to the person, stop eating roti and curry, but try to eat roti, maybe lunchtime with your curry, and try, when you used to have 5 roti, which we do, you know, it's easily, you know, maybe stick with 2 and you know, have a paratha roti with brown flour because it's healthier and releases sugar in the blood very slowly. And nighttime, I do tend to say to my patient, just try to reduce the carbohydrate in your food, or have your dinner earlier and go for a walk, but have little portion. You know. So but I must say, with proper health promotion and education, I have been able, and I know my colleagues across Basildon and Brentwood, CCG, we have been able to help the patients in ethnic minority and groups of patients. We've been able to help them. It's also people from deprived community in Basildon and Brentwood. They people, you know, tend to buy ready-made meals, or how many kebab shops do we see everywhere, and how busy we see them. So people tend to just buy ready-made food, or food that you just put in the oven. They're high in salt, and you know, a lot of saturated fat, quite bad fats. So I'm talking about fats that are not good for your health. And so this is our job. This is what we've been doing to promote healthy eating to our patient, because patients find this, especially from deprived community, it's easier to buy ready-made food because it's cheap too. It's cheaper, but they find it cheaper to buy something quick, you know. But if cooking your own food, buying your vegetables, buying your meat, making your own bolognese, it's also cheaper if you take time to make your food. And it's food prep, prepare it in advance, making sure it's there, it's ready, even how busy your lifestyle is. And it doesn't have to be ready-made meals. If you start buying vegetables, buying your own meat and cooking it, long term it's cheaper. And it's healthier, less salt, less preservatives in the food. So we, as practice nurses and advanced nurse practitioners, healthcare assistants, that's what we've been doing. We've been promoting this across the CCJ.
No, this is important. So the message you're giving to the families, they should do their own food. Home cooking is
best. Home cooking is the best.
They should eat at home. They should rely less on the takeaways. Because they contain
I'm not saying we shouldn't have takeaway. You know, once in a while a takeaway is good.
That's a treat.
But it's a treat. But don't make it a habit, because it's high in salt. Increases your chance of hypertension, cardiac problem. But when you're cooking your own vegetables, your own food, and you're controlling the portion, and how much salt you're putting in your food, how much additive you're putting in your food, you know, you can prepare healthy food for the family.
So you know, I know some people who, before they eat food, they just put salt. Do you encourage that?
No, that's, you know, I mean, it's a bad, I mean, a lot of people do that. It's a bad habit, because you're putting extra salt in your food. So I know it tastes nice. I know a lot of people do that. In a lot of the communities, a lot of different people like the extra salt in their food, but that's not very healthy.
There's something the viewers will want to hear. You know, we talked about certain habits like smoking. I know some ethnic minorities in Essex or across the UK, some people smoke a lot. Others don't even smoke. They chew tobacco. There's one they call. There's a name they call the sushi. There's one people they say. Well,
shisha. Shisha.
All right. Okay.
The shisha. I think.
Yes. You know. Yes.
Yes.
Yeah. Obviously, you understand what I'm saying. So those people that chew tobacco, are they at risk, just like people who smoke?
Yes, because these chewing tobacco, they put salt, they put different additive in it.
Yes.
It's not good for the teeth.
And tobacco itself is also a stimulant.
Exactly.
All right.
So
it's not a safe practice.
It's not really a safe practice. And to be honest, it can cause other health problems.
Yes, that's correct.
You know, cancers and everything. And these additives they put in it, I don't know how safe it is, and you know, if it's been tested, how safe it is to you know, regularly you know, it's not really a healthy option.
Yes, I mean, you've actually touched on all the key elements of what people do.
Oh yeah, I remember. It's called pan.
Oh, is it?
Pan,
okay.
the chewing tobacco,
chewing one,
yes.
Okay.
Yeah.
So the viewers will understand. So you've touched on all the key aspects. I think if people have hypertension, is it treatable, or are they encouraged to take their medications every day and see their GPs or see the nurses?
Now, a lot of patients will say to me, this is true, they will say, I like my food, I don't have to exercise, and you give them medication, some patient will take, some patient won't take, so you get all type of patient. You know, obviously we can't force patients to take their medication, but we do get some very good results. You know, some patients turn their life around. They started on very small dose of hypertensive drugs, then they lose the weight, they start exercising, and you'll be surprised. Some of them they come off medication.
Right. Okay.
But some patients, you know, we're still working, we're still promoting, we're still trying to educate them, but they're not very compliant.
Yeah, and that brings the risk.
Yes.
If people are not compliant on their medication, if they have high blood pressure, the blood pressure can keep rising until it causes them stroke.
Exactly.
Or it can affect the heart, causing heart failure, isn't it?
That's where our role that's what our role is, to prevent these. As nurse practitioners and practice nurses, I am always advising my patient. I know sometimes it's like you're scaring them, but you have to tell them. You know, as GPs, you know, we have to tell them, you will end up with a stroke if you don't lose the weight. It will cut down 10 years off your life. Your Q risk factors, Q risk, you know, for the audience to know, is your risk of having a cardiac heart problem, a cardiac event, and a stroke in the next 10 years is quite high. So it's about letting his patient know the risk, educating them. I think education plays a big role. It's about educating them and telling them, and getting that message across and building that relationship with the patient. It's when you're building that relationship and your patient trusts you, that's when you can bring a positive.
Viewers, you can hear the specialist has done good justice to the topic for today, which is hypertension. She's broken down the language in simple form so everyone can understand. But what the message she's giving us today is we can prevent having high blood pressure by the things we do, regular exercises, our food. But even if you have high blood pressure, you should do all these exercises as well she's mentioned, and control your food, take your medication. People who are not taking their medication are running the risk of ending up with bigger problems like stroke, heart attack, or diabetes. And we don't want that. So please listen to the specialists. You can view this clip time and time again so you can understand the message, and tell this to the members of your family so that they will know. And if you have any questions, you will see our address. Send us an email. But we thank you for watching, and we thank the advanced nurse practitioners at the Thomas for doing justice to this topic. We've learned a lot. Thank you very much.
Thank you. It's been a pleasure.
Next time, we're going to invite you for another topic because you have vast knowledge in health.
Thank you.
Okay, you're welcome. Thank you very much. And thank you, viewers, for staying tuned until now. And we hope you enjoyed today's program. Thank you.